Social Development partnered with the Nedbank Foundation, and we had to choose programs that we can do with Nedbank Foundation. And one of the programs that is important to us from a women's health and from a positive parenting and strengthening families together. So once again, it's that day again where we are saving lives, but today it has been made possible by Nedbank Foundation, and we're very honored to have partnered with them.
Today we have a fantastic opportunity to touch the communities in which we operate. You know, at Nedbank we take that really, really seriously. Health services is such an important part to making sure we're building a sustainable business. I must say a huge thank you to the Department of Social Development and especially the Deputy Minister, Bokhabani Zulu. I think just from one phone call, all this happened. PinkDrive does a fantastic job going around in communities to bring the health services to those that don't have access to it. And as Nedbank, we see that as truly doing something different in the communities, truly helping those communities. And PinkDrive allows us to be able to do that.
What we are doing here over the 5 days is we're offering education on breast cancer, cervical cancer, prostate cancer and testicular cancer. We're also doing clinical breast examinations because we believe it is important that women know what to do and when to do it. And ultimately that way they'll start taking responsibility for their health, especially in a country where resources and access to health are so scarce.
So health is one of Nedbank Foundation's key focus areas. Our objective there is to provide access to healthcare services, especially to rural areas like this one. And we also support disease awareness as well as advocacy. We believe that as a bank that cares for the communities, we need to come into these particular areas where these kind of services are not available. So for Nedbank Foundation to support PinkDrive, we believe that it will certainly assist these communities in this particular area, because most of the community members here can't afford to go to hospitals. Hospitals are very far from this place, and for this service to be brought in this area, really we believe that people will get assistance, they can be tested. We do believe that prevention is better than cure.
We are expecting today, before we leave here, they tested 500 people. So we like to thank Nedbank, PinkDrive and SASA also, because after you test, you are going to get something. Because we want our people to check and test so that they must know and they must prevent if there is something or sign of cancer. They must prevent it before it becomes strong in their bodies.
This is a very poor municipality, first and foremost. It also does not have health services. It costs 50 Rand for a taxi to go to the nearest hospital, one way. And the community relies on our social grants. That's the only income. And that is why we chose Marezane. But also, this is part of our comprehensive Mikonzo intervention, our ministerial footprint, where we have profiled the community and we've identified that there are quite a number of challenges in this community.
I'm privileged and honored that my community is the one that has been prioritized. We have 27 villages here with a population of around 300,000 people. But to be one of the community that got prioritized brings a huge relief into our community. The only thing which for me is a bit of a concern is that this will be a once-off, because